Thank you. My name is Taras. I am an AI engineer and co-founder of Elomia Health Company. My company was founded back in 2019 as a lab at the overlap of mental health and artificial intelligence. Our product's name is Elomia, and this is a chatbot for mental health support. We have a clinical team led by Anastasia Kinesh, PhD in psychology and member of American Association or American Psychological Association. So there are several research which describe the efficiency of this product. In particular, a research recently initiated and conducted at the University of Pennsylvania. So this is one of the most well-researched product, and most of our clients are based in the United States of America. So we are based in Ukraine. I'm Ukrainian, and all our team members are Ukrainian too. But Elomia has not been available in Ukrainian language. Also, we understand the implications of ongoing crisis. Over the last year, we have done a lot of work to make this product available in Ukrainian language. And during the next 10 to 15 minutes, I will tell you about researches we conducted. So, how the use of artificial intelligence for psychological support in Ukraine is different from practice in the United States. I will tell you about related risks, about our Ukrainian version, and about our next steps. I will start with overviewing the challenges. The challenges we have identified. So we did in-depth interviews, around 15 interviews with people from various populations, veterans, psychologists, and each interviews took us up to 3 hours. But before I tell you more details, you need to understand that these problems are different depending on the place of residence, depending on the place of deployment, and depending on the patient inherent characteristics. So I want to share with you several stories, several quotes, so you best remember it, and it's the most obvious. So a few stories we've heard. First of all, people may receive psychological support at military hospitals, but unfortunately many military hospitals have limited resources. And it's a quote by a psychologist from a military hospital. Our clinic has terrible conditions for psychological work. Only one office, which is almost busy. Most often I have to work in a hallway or in a team with 8 other people. Can it be considered diagnostics? Can a person open up? And some military units have psychologists, but often it exists on a paper only. A quote from military: "I'm a psychologist at my unit because I was ordered to do it. I received 1 day of the training. Training was 2 hours long. Now I'm considered psychologist, but it's only on the paper." Some people don't even believe that the system is capable of providing competent mental health support. A quote by military servicemen: "I don't believe in psychologists in military system. If they are, these are some kind of clowns who dropped out of college." And another quote: "I had a woman, a woman came to me, 10 minutes appointment, she offered me to breathe. It really didn't help." Some military servicemen consider private appointments, but because they are concerned of confidentiality. If I need a therapy, I will go to a private practitioner because public practitioners from system are incompetent. However, many military personnel won't go to private practitioners because they are civilians and they don't trust it. 9 out of 10 patients don't believe in psychologists. What can you do for me? You don't understand anything. This skepsis is also is often due to civilian status of psychologists, like they don't understand the experience. Sometimes military are ashamed to recognize need for help, especially when they compare their mental health difficulties with potentially with severe physical injuries of their fellow soldiers. So he lost his arms and legs. And what's wrong with me? I am ashamed to distract resources from some people who really need it. Some are afraid of being stigmatized as cowards. They just complain on nerves because they don't want to fight. They just want to sit in the rear. Some may seek support from families, but seems still some struggle to open up even before the loved ones. So I'm just sit and I feel bad. I feel like sharing it, but I don't have anyone to share. I can't tell it to my wife. I don't want to traumatize anyone. And as George mentioned, alcohol and drugs are sometimes used for self-medication. So you try to find exit, and the glass of alcohol or other substance is the only way to help you. But we also heard a lot of positive stories about NGOs who offered real support, about military psychologists who offered, and which is highly appreciated by military. These are a few more quotes, real quotes from real people. So these problems exist, and it was really important for us to take a look at the problem through the eyes of the military, through the eyes of our potential users. And yes, we have two problems here: lack of resources and lack of trust. Can artificial intelligence help to address these problems? First of all, let me tell you about the most popular use of artificial intelligence in psychology. It's most popular in United States. And recently, on September 15, the developer of ChatGPT issued a report on the use of their product. So basically, a week and a half ago. And then, according to their report, 14 million people are using ChatGPT for mental health weekly. On social media, I once saw a blogger describing ChatGPT as the largest mental health hospital in the world. So we wanted to learn more. What's going on in Ukraine? Does Ukraine also follow the trend, or does it happen somehow differently? Maybe since military are people who often distrust technologies. Unfortunately, we haven't found any large studies in Ukraine, large trustworthy studies in Ukraine. This is the reason why we did our own research. And we started with a small questionnaire, anonymous questionnaire, and of course, questionnaire is not a super reliable source, the survey, but at least we can shed some light, at least partially, on this realistic picture. And these are some of the results we have received. 40 military veterans of military and active deployment who participated in reported they felt emotional relief after talking to ChatGPT. 25% stressed said talking to ChatGPT helped them to better understand their emotional condition. 23% of respondents report that due to the shame, there are some topics you can discuss only with artificial intelligence. 20% discussed with ChatGPT their combat experience or traumatic events. 16% regularly use ChatGPT for emotional support. And 10% discussed with ChatGPT their thoughts about self-harm or suicide. So, use of artificial intelligence, most often ChatGPT, is quite popular in the United States and seems like it's growing more popular in Ukraine. And it's not a surprise, because from a point of view of an end user, military personnel veteran, it's a rather convenient tool. First of all, it's private and it's just an application. You can install it, and if it doesn't work, you can simply delete it without telling anyone, so they can start using it anytime without fear of judgment or stigmatization, like it usually happens with psychotherapy. Moreover, it's 24/7 accessibility. They can talk to at night or when there is no one around. And moreover, it's cheap. ChatGPT is a free of charge application. They can receive this support easily and without any losses, without any risks. So it's free, but even a premium version costs much cheaper than the psychotherapy in Ukraine. Also in Ukraine, as compared to the United States, therapy is much more accessible. However, there are some risks associated with this use of artificial intelligence in the United States. There are public debates whether artificial intelligence can be used for mental health support or no. Over the last week, there were several articles released, and there are more and more articles about tragic cases related to such use. For example, a teenager committed suicide after several months of encouragement by ChatGPT, or a psychiatrist had 12 patients with psychosis caused by use of artificial intelligence. There are multiple publications and like this in multiple cases. So what's the problem here? First of all, when a person needs professional support and sometimes inpatient treatment, but they start to use AI assistance, sometimes it simply delays the seeking qualified help. Secondly, how chatbots are often very convincing. So a final user may feel like may really trust. But it's simply a chatbot, and chatbot may skip some important detail, may provide ineffective advice, or may just provide medically inaccurate information. But due to this convincing nature, end users will never notice it. And finally, chatbots tends to agree with you. They want to be nice, and often chatbots, when you use it for mental health support, it will simply validate your cognitive distortions, and sometimes it may even indirectly encourage harming others. I have a different example here. It's an article on Wikipedia called Chatbot Related Death. There are 6 cases in it, and here's one of them. In August 2025, a former Yahoo leader killed his mother and committed suicide after talking to ChatGPT, that fueled his paranoid ideations that his mother's poisoning him and conspired against him. Chatbot basically confirmed his concerns that his mother could put psychedelic drugs into his car vents, and said that a check receipt from Chinese restaurants contained mysterious symbols connecting his mother to demons. So can ChatGPT safely used instead of psychotherapist? No, it's obviously unsafe. But nevertheless, whether we like it or not, this technology is used this way by tens of millions of people.
And it seems it's going to be more and more people using it, and there is nothing we can do about it. What we can do is to try and create a safe alternative. So this alternative actually is our product. This is how we conceptualized it. We try to translate it into Ukrainian. It would have the advantages of AI. It would be accessible. It would be private. It would be safer for mental health. So unlike ChatGPT, which is AI for general use, our chatbot, it was developed for mental support. So during its development, we used specialized data sets that were developed by our team, and also many levels of checks. So from the planning stage to the to launching it, the system was under supervision of a clinical team. So unlike ChatGPT or other assistants, IOMI will not try to diagnose you or to connect your symptoms to diagnosis, and it will not give you treatment. So it's more like evidence approach. So it could give you certain techniques or exercises, scientifically based, and it will tell you how why it is useful and how you could apply it in various life situations. Also, there are safety protocols. So the app will refer you to other resources when it will understand that it's not enough. So that for more qualified assistance. So it also helps people get stronger, become more confident to to make maybe the first step in their life, step to getting professional help. So before launching it, we had a little pilot in Ukraine. So I would like to share a few quotes from the pilot participants. I felt support and understanding. I saw the situation from the standpoint of other person and understood it differently. There is somebody who is always ready to listen to me. I can talk without being afraid. It really helps. So now it's available to download for iPhone and Android in Ukraine. It's in Ukrainian language, and you can use it already. So now we are interested in finding partners with whom we could do effect if maybe organizations that help veterans or defenders or vulnerable people to do the research of its effectiveness. So AI is a thing that needs constant attention because all people are unique, all cases are unique, and we will see things that are going wrong, but we are ready to correct them. I believe that in the world there is an official statistics in the world, and there uh, so it could be related to children also. There is responsibility for the incidents that happened. But 14 million people use this every week, official statistics. So I would like for the world to have a certain alternative that the people could actually really rely on and to trust it. So this is our mission. And if there are any questions, please be quick. And where is QR code? You can find it here. Uh, the number percents, not many, less than 100 was anonymous Google form questionnaire. You could identify yourself as a serviceman or veteran or civilian in this questionnaire. There were categories. So statistically these are not they can only allow us to see a certain part of the issue, this data. Thank you for your speech, Taras.